How does heart blockage progress? Over months or years or days? Hi friends, I'm Dr. Toishi Sharma, Interventional Cardiologist, and today let's talk about this common question. So most people imagine that a heart blockage grows like a rust on a pipe, slowly and very predictably. But coronary artery disease is more like a living inflamed wound inside the artery. It can stay quiet for many years, but then it can cause symptoms suddenly. So what is actually a blockage? A heart blockage usually means atherosclerosis, which is a combination of cholesterol, inflammatory cells, and scar tissue building inside the artery wall. This process often develops silently over years, long before symptoms show up. There are two parallel stories happening. Slow narrowing over years, plaque gradually grows, the artery lumen tightens, and the symptoms like chest pressure or exertion can appear. And there can be a sudden event without severe narrowing. Why? Because a plaque or a blockage can suddenly become unstable. It can crack or erode and form a clot, causing a heart attack, even if the prior blockage was not severe, like 80 or 90%. That's why many people feel fine and still have a heart attack suddenly. So, what about progression? The progression speed is highly individual. It depends on risk factors like LDL cholesterol, smoking, diabetes, history of insulin resistance, high blood pressure, inflammation, sleep, stress, and genetics. In some people, plaques are relatively stable for years. In others, progression accelerates in months, especially if multiple risk factors are uncontrolled. So what actually stabilizes the plaque? Statin medications and intensive lowering of lipids has consistently shown to slow the progression and stabilize the plaque, causing plaque regression in some patients as well. And that's why modern guidelines recommend aggressive risk factor control, lifestyle changes, in addition to medications for chronic coronary artery disease. And importantly, plaques can become more stable even before you can see any change in the percentage blockage, which can happen in some cases. So, heart blockage usually progresses over years, but events can happen suddenly when plaque ruptures or erodes. I hope you found this information helpful, and the best thing that you can do is to get regular checkups with your cardiologist and your doctor to make sure you're getting the right testing done and the right clinical examination done on a regular basis to ensure that your coronary artery disease remains stable and we can minimize your future risk of heart attacks. Thank you.